गुड इवनिंग एवरीवन। मैं हूं आपके साथ अंकिता चंद्रा और एक बार फिर से मैं इस लाइव सेशन बी फ्री सीरीज में आप तमाम दर्शकों का बहुत बहुत स्वागत करती हूं। लगातार जो लोग हमारे साथ जुड़ रहे हैं उनको बता दूं कि आज का जो हमारा विषय है वो है कि फर्टिलिटी को कैसे बेहतर बनाया जा सकता है, कैसे इंप्रूव किया जा सकता है। इसी को आज हम जानने और समझने की कोशिश करेंगे। हमारे साथ जुड़ेंगे डॉक्टर सुरक्षित, जो हमें बताएंगे कि कैसे फर्टाइल हेल्थ को इम्प्रूव या एनहांस किया जा सकता है। डॉक्टर सुरक्षित के बारे में मैं आपको बता दूं, वो एंडोस्कोपिक सर्जन है, फर्टिलिटी स्पेशलिस्ट है, ऑब्स्टेट्रिशियन और गायनेकोलॉजिस्ट है। तो उन्हें मैं यहाँ ऐड करती हूँ और हम अपनी बातचीत का सिलसिला अब शुरू करेंगे। हाय, गुड इवनिंग डॉक्टर, हाउ आर यू?
All good, Ankita. I hope you're doing well.
या सो डॉक्टर, आज का जो हमारा विषय है उस और जाने से पहले मैं आपसे जानना चाहूंगी आपकी जो अभी तक की एक्सपीरियंस रहा है वो हमारे साथ कुछ शेयर करें।
I'm so sorry, Ankita. I don't understand Hindi because
ओके,
I am basically from Tamil Nadu. So, our Hindi experience is very, very little. I have been to Mumbai. I was there for a year, but
ओके,
unfortunately,
नो प्रॉब्लम,
Hindi
टेल अस समथिंग अबाउट योर एक्सपीरियंस।
in gynecology.
या
Okay, so I have been a gynecologist for the past 8 years, and I have my own hospital, Indigo Women's Center in Chennai. And so we take care of everybody who's looking to get pregnant, those who are trying hard to get a baby, but unfortunately have no baby, and people who are looking for surgery through laparoscopy. For example, they have big tumors in the uterus or they have big cysts in the ovary. For those people, we are able to do surgery through laparoscopy. They come on the morning, by evening, they go back home. Those are daycare procedures. And also, we deal with cosmetic gynecology. This is a very new trend where basically a lot of people who are having issues of feminine wellness, for example, if they're having excessive white discharge, which is not going off even after they take medications, or if they're having, urinary incontinence. A lot of people are having that. For example, they go for a run or they go to the gym, they just
या
jump a little and they have a dribbling of urine. So all of these things can be solved by basic procedures in the OP. It only takes 10 minutes. And these are the new cosmetic gynecology procedures. So I basically take care of all women issues under one roof.
exactly. And it's a pleasure for us that you are joining us today and between your busy schedule. So doctor, my first question is what exactly is infertility?
Yes, Ankita. The important thing we need to understand is how do you define infertility? Which means if any couple who have been trying for pregnancy for 1 year and they were
Yeah.
having no pregnancy, that is without any protection, no condom, no contraception, nothing of that sort, no pregnancy, then at that point of time, we say the patient is infertile. Okay. And this of 1 year period is cut short to 6 months if in case they are above 35 years of age. So anyone who's below 35, we ask them to try for 1 year. Above 35, we would say it will be 6 months.
And how will a couple comes to know that they will now need a fertility expert help?
Exactly. As I've already told you, once they understand they are trying for 1 year, but there is no baby, that's when they have to decide to go to a fertility clinic to get treatment.
Can there be both reason that is related to male and female both for infertility?
Of course, in fact, a lot of people think that this is a female issue or a woman issue. It is
Exactly.
absolutely not true. It's
And
a
somehow
big
social
taboo.
stigma is somehow related.
I know there's a problem with
Yeah.
how all the mother-in-laws, they push the woman to actually go for treatment, but most of the time the guys also will require treatment. In fact, if you see, it's around 50-50%. So 50% will be women's issues, 50% will be male issues. So, yes, absolutely.
And what exactly causes female infertility?
So you see, the most important thing what we need to understand is why there is infertility. Either it's an age factor, If in case, as you know, no, as people keep aging, the number of eggs also keep reducing. For example, when you're born, you are born with 2 million eggs. That same 2 million eggs will become 200,000 when you are around 20 years of age. So from 2 million to 200,000, there's atresia. And once you are crossing 35 years, it doubles down. So drastically, you keep reducing the eggs. So of course, the chance of pregnancy will come down. So most important is the age. The second most important factor is if there is any issue with the release of the eggs. Some people have polycystic ovaries, instead of the eggs releasing, they form tiny cysts inside the ovary. Those are polycystic ovaries. The next important thing is if there's any problem in the fallopian tube. That means the fallopian tube does not
Blocking.
carry the egg. It does not carry the egg from the ovary into the uterus. So that might also be a problem. And finally, the third issue will be like inside the uterus. So there is a big mass, or if there is a polyp, or there's something which is not letting the pregnancy happen. So these are the basic issues what a woman can usually have, which might cause infertility for her.
And does this also happen due to sexually transmitted disease that also causes infertility, whether in men or women?
So Ankita, if you see, infertility might not be directly related to sexually transmitted diseases, although we do know that STDs can spread from male to female and vice versa as well. But more importantly, what causes this kind of fertility is that it causes why one person gets infertile is because there is infection. Infection can go from inside the vaginal canal into the uterus. So when this happens, you have options of infertility happening. Yes, of course.
And what are the treatment options available for women infertility, and how one can what are the diagnosis available, diagnosis options,
Oh,
how to
of course,
diagnose?
there are. Yeah. I mean, as I told you, there are several factors. One, we have from the eggs. How do you check whether the number of eggs are there or not? First, you do an ultrasound scan. It will let us know how many eggs are available in both the ovaries. The other thing what we can do is we can do an AMH test, which is also known as anti-Mullerian.
Anti-Mullerian hormone.
Exactly,
Yeah.
yes. Yes, that will let us know exactly how many eggs are available. Then you can check the fallopian tubes. We do this thing called as the HSG or the hysterosalpingography, which will allow us to understand whether both the tubes are open or not. And then finally, for the uterus, you can of course do an ultrasound or an MRI to know if there's any problem inside the uterus.
And what exactly causes male infertility? What are the reasons behind male infertility issues?
So, it's funny, Ankita, that, for women, there are so many things which can go wrong. But for males, it's very simple. There's just two important things. Number one, if in case he has any problems like erectile dysfunction, or if he's having sexual dysfunction, or, anorgasm, these are issues which they can have, which can cause this kind of issue. That is male infertility. And the second one is, of course, if the number of sperms is less or zero, at that point of time, we say that they have infertility. So only two most important reasons for males.
Okay, and how one can diagnose that? And what are the
So,
treatment options for male infertility issues?
so it's very simple. For men, again, we ask them to give a semen sample. And we will test it under the microscope to see how many sperm is available. If it is a normal sperm, we would say it's a normozoospermia. If the number of sperm is okay, but the number of sperms, more of them are abnormal, we say that it is teratozoospermia. And if in case there are more sperm which don't move at all, we say it's asthenozoospermia. So of course, these are the various terminologies we have. And of course, if in case they are not able to have any kind of sexual contact, then we know, of course, they are having a problem with the male dysfunction as well. So at that point of time, we can go in for further treatment for the males so that, we can solve this issue.
And how can fertile health can be improved in women? What are the options available?
I'm sorry, I didn't get the question. How?
How can infertility be improved in women?
So we need to understand where exactly the problem lies. If in case the number of eggs are less, unfortunately, there is no treatment for that. Only recently that new treatments are coming up like PRP and stem cell therapy, where they inject PRP directly inside the ovary to improve the number of eggs, hopefully. But these have been working for some people, where 50% of them, they don't have any results. And of course, if in case there's a tubal block, at that point of time, we can release the tubal block by doing a fertility enhancing laparoscopic surgeries. This will help for women trying to conceive. And of course, if in case the tubes are completely blocked and if you're not able to even solve it, even after doing a fertility enhancing procedure, at that point of time, we can go for IVF, where basically we bypass the fallopian tubes, we get all the eggs outside, we make the pregnancy outside, and then we put it back inside the uterus. And
Yeah,
if
yeah.
in case there's any issue inside the uterus, at that point of time, again, we can go ahead and do a laparoscopy, and then we can remove all of the fibroids and we can remove all of the cysts, and then we can ask them to conceive after 3 months.
Okay. And one of our viewers is asking, what if the AMH level is more?
So there is no problem. If AMH level is more, they're very lucky.
Yeah.
They have very good chance of conceiving. So there is absolutely no problem at all.
And as you said earlier, that age matters a lot. But as we all know that today women are career oriented, they focus on their career. Then what are the options available for them? How can they improve their fertility?
Absolutely, very good question, Ankita. What we need to understand is how to preserve the fertility for women who want to delay their pregnancy for a later date.
Yeah.
So in that situation, what I would say is, most of the working women who decide to go for that will be somewhere around 25 to, 30 years of age. That is the best time when they can go and they can freeze their eggs. So what they can do is they can freeze the eggs so that once they have decided to get pregnant, maybe around 40 or 41. If I'm just giving an example, they can even go ahead and plan even before. If they get pregnant, well and good. It's more like an insurance policy. Why do you need to take insurance? Not that the next day
Yeah.
something is going to happen to you, but if by chance something happens, you always have a reserve where you will be able to use those eggs, and they will always be very good quality, because as you keep aging, the quality of the eggs will always go down. So every day, the quality of the egg goes down a little bit. So the faster you plan for the procedure, the better it is for you.
Yeah. And how can fertility can be improved in male?
So for males, yeah, I think for males, of course, lifestyle changes, just like for women and for men, lifestyle changes go a long way. I always say a healthy workout is very important. Healthy diet also is absolutely key. And of course, now we're all stuck to the phones and stuck to the laptops.
Yeah.
We also have to take a break from that. Make sure that every half an hour to 45 minutes, once you're from your desk, stand up, walk around, and then come back. That kind of mobility and movement is always very important. And of course, supplements play a very big role. For male infertility, especially, we ask them to take, several products are there, which are basically, antioxidants, which will help in boosting the semen parameters.
Okay. And someone is continuously asking the same question. It is not related to our topic, but still I
Okay,
can take. Yeah, please
okay.
discuss about recurrent miscarriage and no fetus heartbeat.
So recurrent miscarriages are usually divided into, four parts. One, if it happens early in the pregnancy, that is the first trimester. If it happens in the second trimester, that will be, in the middle of the pregnancy, up to 23 weeks. And then finally in the third trimester, which will happen around 30 to 36 weeks. So the most important one, which happens in the first trimester, is most of the time genetic causes. Genetic causes can be the predominant one. So ideally, they want to make sure that they have no problems. Both the male and the female are genetically normal. Even the fetus, whatever is developing inside, if in case it comes out very early, they should take it and send it for genetic testing to know what exactly is the problem. And also, we need to know if there are any blood parameters. For example, there will be certain parameters in the blood of the woman which will not let the pregnancy continue. So at
Yeah.
that point of time, again, we have to go, and there are a lot of tests for that. So we do in correlation, not only the fertility specialist, along with the hematologist, and the immunologist, we all work together in treating this issue. And we have a lot of patients who have the same issue, recurrent miscarriages in the early pregnancy, and by giving them treatment, definitely they have a good chance. So up to 3 times in the early pregnancy is considered to be normal. If the same thing happens in the second trimester, at that point of time, we need to go ahead and put a cervical stitch. So this way we make the cervix very strong and the baby does not come out.
Okay. Someone has asked that question, how we can improve our egg quality? What are the
I'm
options?
so sorry. This is the same thing I think, Ankita, I also mentioned to you earlier.
Yeah.
The topic was actually how to improve the, egg
That's why we
quality.
had changed that topic.
So we
Yeah.
changed the topic name because it's impossible to improve on the egg quality. There are a lot of new studies which have come which are showing that stem cell therapy may help. So all of these things we cannot recommend yet until we have strong evidence saying that it is working, and only then we can go ahead and do this treatment. Otherwise, as a doctor, we still cannot recommend it.
Okay, and Akansha is asking, please let me know if prolactin levels are high.
You should tell us, Akamsha, if your prolactin levels are high.
Okay.
So, if in case it goes above 100, and of course, any level above 100 in prolactin, we would say is a high hyperprolactinemia, and definitely we need to undergo further treatment to understand, why you're having that issue.
Okay. And someone is asking, what if the AMH level is low?
Yes, if the
What
AMH
they
level is. So again, it depends on the age. If in case she's around 23 to 25 years of age and her AMH is very low, at that point of time, what I would suggest is try to conceive for the next 1 year. If it doesn't work, then they might have to undergo treatment to make sure that we get all the eggs outside as early as possible, make the fertilization outside, and then put it back inside the uterus. Sometimes these people with very low AMH might have to do at least 3 or 4 cycles to get more number of follicles so that they have a good cumulus of embryos. And when they transfer that, definitely they have a good chance. So especially girls and women who have low AMH, which in fact, Ankita, you need to understand this is at a very high rate right now. A
Yeah.
lot of people are getting low AMH values,
AMH.
and I always suggest make sure you understand your fertility level and take treatment accordingly.
And how the conditions like PCOD and thyroid can affect fertility?
I have already informed, like what happens due to PCOD is that the eggs don't release. So instead of
Yeah.
eggs not releasing, they form tiny cysts inside the ovary and they become hard and resistant. So they form a big shell outside the ovary. So what happens is they don't release their follicles anymore. So at those point of time, we might have, at that point of time, we might have to consider going for fertility enhancing procedures to make sure we release all of these follicles, and then they will be able to conceive.
And what is the role of folic acid? I have read also somewhere that folic acid is very important during pregnancy or before planning for a baby. Why so? And how can we take, how much one should take folic acid?
Yeah, I think usually we say folic acid should be taken 1 tablet daily. That is like a standard, protocol. It has been given for a lot of patients who are trying prenatally as well. Folic acid definitely plays a big part for patients after they conceive because it helps in the neuronal development of the fetus. But the real use of it natally, it's not too high, but of course a lot of people do recommend it, although more studies are required for us to start recommending them in a large scale.
Okay, and here one more question. Are there any physical attributes which indicate low fertility?
Physical attributes,
Yeah.
I don't think there's nothing physical which can say that you're going to have low fertility. I don't think you can look at a person and say this person has low fertility or not. Of course, unless they get married and they try for a year, nobody is going to know their fertility potential.
Okay. And one more question is there, how to improve sperm count?
And
Someone
in
is
fact,
suffering from low
Ankita,
sperm count.
Sorry for stopping you. In fact,
Yeah.
a lot of bodybuilders, if you see, they have very low sperm count because of all the exogenous testosterones and things they take. Even though they look like they are physically fit, and you'll think that these guys will have good sperm count, but unfortunately, a lot of them come for treatment because their sperm count is very, very low. So you cannot really definitely look at a person and decide whether their sperm count is going to be low or high, yeah, or even for women for that matter. It's not required that all obese women will have infertility. I've seen a lot of people who are athletic or women who are fit still have a lot of infertility. So I don't think you cannot put physical attributes for infertility. Not at all.
Okay. And if a woman is overweight or underweight, does this also affect fertility?
Absolutely. I mean, I was just giving an example of how we also have people who are underweight and who are infertile. But of course, if you look at it, the major statistics are obesity by itself will cause infertility. It's because you have a lot of peripheral conversion of estrogen. So when that happens, no, and you also have a high chance of having polycystic ovarian disease. So all of these things in general will definitely cause a lot of issues in women. And having a good, healthy diet will definitely go a long way in trying to improve the fertility levels.
Okay. And as we all know that the present scenario, work from home is there and all are working throughout the day, 8 hours to
Yeah,
12 hours. Working hours is too high. So what one
absolutely.
can do to come out of it? That stress also causes infertility. Is it true?
Absolutely. Absolutely. I think you hit the hammer right on the nail. Because right now, because of all the work from home and the stresses from, just staying under four walls, see, we as
Yeah.
humans are social animals. Okay. We need to go out. We need to be interacting with other human beings. That's the way we are. And if that is not happening, it is going to build up a lot of stress. And of course, we cannot beat the stress by going out and taking the risk of getting COVID. So rather, what you can do is you can try to focus on yourself. Try to improve your mental health, because a lot of us as Indians, we forget about mental health and how much it is
Yeah.
actually affecting us. So not only the physical health, but also the mental health have to be taken into consideration, and start working. Start introspecting, finding out what exactly is that one thing that you need, and try to meditate. All of these things will definitely play a long thing in trying to reduce our stress levels.
Okay. And what are the natural ways to boost fertility in men or in a women?
I think dry fruits, antioxidants, good protein shakes, all of these things, and of course, taking a good healthy diet. Mediterranean diet is what they say is very, very good for women fertility, and for males, of course, also Mediterranean diet works very well. There is salmon and bread and vegetables. I would not recommend everybody to eat a lot of fruits, because a lot of people think, if you eat a lot of fruits, you're going to, what do you say, automatically improve your fertility level. That's not the case at all. Fruits are very good if in case you need a sudden boost of energy. For example, you're going to the gym or you want to go or something, you're taking a banana is going to go a long way during that time. But if you just eat a banana every day, like two or three bananas, it's just going to make you put on more weight. So avoid fruits, take more vegetables. It's going to help a long way.
And what are the lifestyle changes or modification needs to be adopted to improve fertility?
Absolutely. I think one of the most important ones are to make sure you are always moving. Try not using the lift as much as you do. I always say try to use the stairs. Even though you have a lift next to you, use the stairs. As I already informed, try to get up from the chair and go for a walk every 45 minutes, and keep yourself active at all times. This is the only way of how we can naturally improve our fertility levels, other than the food what we eat.
And if we see the present scenario, this pandemic situation, I think one of the posts is going viral that does COVID really affect erectile dysfunction?
Again, Ankita, it's a very important question you asked. As such, there is no relation of COVID affecting male erectile dysfunction, but rather COVID by itself is causing some issues in the spermatogenesis, that is the formation of the sperm. So a lot of people are having issues of low sperm count, and it's not only for men. In fact, even women who are becoming pregnant, they do have a lot of chances of having a premature labor, premature birth. So all of these things are becoming more common, but unfortunately, there is not enough data for us to just say, like, evidently, like, yes, this is happening. Unfortunately, more data is being collected right now, and once we have more evidence, definitely we'll be putting it out in the coming future.
Okay. And does the COVID also affect fertility of women?
Of women, not exactly by affecting fertility, but a lot of women who are pregnant, who are having COVID, are having chances of having a premature birth. That is, before 38 weeks itself, the babies are being born, either because of rupture of membranes or because of ladies having pains much earlier. But again, we do not know why this is happening yet. But definitely, there has been an increased rate of these happening after the COVID-19 virus.
And one last question. Sometimes it happens the couple have been trying for 6 months, but there is no problem, and there is only one problem, and it is related to the ovulation cycle.
Yeah.
Can you elaborate how to track it? Because women are still confused how to track, what are the signs and symptoms.
Yeah, no, absolutely. I think this is also a very, very important question. See, there are several ways of how you can track your ovulation. The first important way, which is the most easiest way, is to check your basal body temperature. There will always be a shift in temperature when the LH level rises. So this will be somewhere between the 12th to the 16th day of the menstrual period. So once we understand that basal body temperature is rising at that point of time, that means yes, ovulation is occurring. Some of them will have some kind of discharge from the vagina during the same time. That again is an indication. Some people will have ovulatory spotting. 1 or 2 spots of blood they will have during those days. That is the middle of the cycle. That is ovulation spotting. Some of them will have ovulation pain. They will know, yes, they'll, in fact, some of them are so specific. They'll say, yes, it came from the left side or the right side. So, it is specific pain for some people as well. So these are ways of how they can naturally know whether they have ovulated or not. There is another method as well. They can check the urine LH levels, which are small kits which can be, they can buy it, and they can check it by putting a small drop of urine on that. And that will let them know if in case the ovulation or not. I mean, whether they have ovulated or not. And the most easiest way is to go to a nearby scan center and check whether the egg has released or not. That is like the diagnostic one. For example, if all of these are indirect methods of finding out ovulation, the direct method would be to go and do an ultrasound.
Okay. And the final takeaways for the couple who are planning for a baby or those who are suffering from infertility issues, what you can say for them?
So I think, Ankita, the most important one is never give up. Okay. Yeah. Everybody starts somewhere, and there's nothing wrong in seeking treatment. These are 3 very valuable tips I can say, because the first one is everybody starts somewhere. So don't think, oh my God, is it too late for me? Should I go right now? No, go, because it's never too late. Second, everybody starts somewhere. It's not required that, for you, it's not required, oh, okay, my friends have gone much before, only I should have gone. There's no, you start now. That's more important. You have made the first step. That's more important. So try to make sure that, as early as possible, you seek treatment, and definitely, it is going to give you a success at the end of the day. And also make sure you choose the right clinic. Find out the doctor who has the same kind of mentality as you, and you both sync. Because trust me, fertility treatment is like a journey. Okay, it's like a journey with you, the couple, and as well as the doctor. So find out if you have the same wavelength, and then go for treatment, so that it will be beneficial for you as well as for the treating doctor as well.
Okay, thank you so much, doctor, for taking us to your precious time for us. It's a pleasure. Thank you so much.
Thank you so much, Ankita. Thank you for having me.
Thanks. Bye.
Have a good day. Bye-bye.
बाय। तो आपने देखा कि किस तरह से डॉक्टर ने बताया कि फर्टिलिटी को आप इम्प्रूव कर सकते हैं, क्या कुछ उसके तरीके हैं, किस तरह से आप अपने जो लाइफस्टाइल में मॉडिफिकेशन करके अपनी फर्टाइल हेल्थ को इम्प्रूव कर सकते हैं, चाहे वो मेल की फर्टाइल हेल्थ हो या फीमेल से रिलेटेड फर्टाइल हेल्थ हो। तो इसी के साथ आज के हमारे इस लाइव सेशन में फिलहाल इतना ही। फिर होगी आपसे मुलाकात एक अगले और नए विषय के साथ। लेकिन आपके मन में भी अगर कोई विषय है जिस पर आप चाहते हैं हमारे डॉक्टर से जवाब, तो आप हमें वो विषय के बारे में जानकारी दे सकते हैं। आप हमें कॉल कर सकते हैं, व्हाट्सएप कर सकते हैं। हमारा नंबर है 636-636-3030। तो इसी के साथ आज के हमारे इस लाइव सेशन में फिलहाल इतना ही। तब तक के लिए स्टे हैप्पी, स्टे हेल्दी एंड ऑलवेज स्टे विद सेल्फी। थैंक यू सो मच।